Bismillah ar-Rahman ar-Rahim. Bismillah ar-Rahman ar-Rahim. We are going to continue our lectures on vitamins after finishing vitamin A, and now we are going to discuss vitamin D, specifically vitamin D3, which is termed cholecalciferol or anti-rickets vitamin or anti-osteomalacia vitamin. Vitamin D3 is synthesized inside our body by exposure to the sun rays. So it is termed sunshine vitamin. So vitamin D is the sunshine vitamin, and it can be synthesized from cholesterol after it is changed into 7-dehydrocholesterol. 7-dehydrocholesterol is present under the skin and when or in the subcutaneous fat. When it is exposed to the ultraviolet rays, it will be cleaved and converted into vitamin D3 or cholecalciferol. So vitamin D3 is one of the vitamins which can be synthesized by our body cells. What are the different sources of vitamin D3? Vitamin D3 can be supplied as a provitamin, which is the precursor of vitamin D3, as I mentioned, by exposure to the ultraviolet rays. The provitamin itself is present in animal tissue only because it is present in the subcutaneous fat. It is formed from intestinal mucosa from cholesterol. So cholesterol is changed into 7-dehydrocholesterol by intestinal mucosa. Then it passes to the circulation to become subcutaneous. When it is exposed to the ultraviolet rays, it will be converted into vitamin D3. The sources of vitamin D3 itself are the cod liver oil, tuna liver oil, egg yolk, butter. But we have to remember that milk is a poor source of vitamin D3. Vitamin D3 has to be activated by a process of hydroxylation, 2 hydroxylation steps that occur in the liver and kidneys. So when the 7-dehydrocholesterol is exposed to the ultraviolet light on the skin, it will be transformed into cholecalciferol. Cholecalciferol then is absorbed to the liver, whereas the first hydroxylation reaction occurs at the position 25, and cholecalciferol is transformed into 25-hydroxy-cholecalciferol. Further hydroxylation reaction in the mitochondria of the kidney cells occurs by 1-alpha hydroxylase to change the 25-hydroxy-cholecalciferol into 1,25-dihydroxy-cholecalciferol. Such a step is stimulated by the parathyroid hormone or when there is low phosphate level in the blood. Hydroxylation reaction in the kidney on another site, the 24th site by 24 hydroxylase enzyme, would result in a less potent form of active vitamin D3, which is 24-25-dihydroxy-cholecalciferol. So the active form of vitamin D3, the most potent is 1,25-dihydroxy-cholecalciferol, and that arise when there is increased secretion of the parathyroid hormone, and a less potent form, which is the 25 dihydroxycholecalciferol. The active form of vitamin D3 acts as a steroid hormone. It enters into the intestinal cells where it attaches to a cytoplasmic receptor, forming a vitamin receptor complex. Such complex will enter the nucleus where it affects certain genes. Such genes will produce messenger RNA, and messenger RNA is translated into calcium binding protein or calbindin. The calbindin or the calcium binding protein stimulates the process of absorption of calcium from the intestine. The dihydroxycholecalciferol in the presence of parathyroid hormone stimulates the release of calcium from bone. In other words, the main function of the vitamin D3 or the active form of vitamin D3 is to maintain normal level of plasma calcium. This can be maintained by increasing the absorption of calcium from the intestine under the effect of calbindin and or by the removal of calcium or mobilization of calcium from bone under the effect of both the active form of the vitamin and the parathyroid hormone. Also, vitamin D3, the active form of vitamin D3, decreases calcium and phosphorus excretion in urine. And this figure shows this the 7-dehydrocholesterol, and here is the 7-dehydrocholesterol because there is a double bond here between carbon 7 and 8. When it is exposed to the ultraviolet light under the skin, this ring will be opened and the 7-dehydrocholesterol is converted into cholecalciferol or vitamin D3. Then the two processes of hydroxylation, the first one occurs on carbon 25 in the liver microsomes by means of liver 25 hydroxylase to convert cholecalciferol into 25 hydroxycholecalciferol. Then in the kidney mitochondria, another hydroxylation reaction occurs by means of alpha-1 hydroxylase in the kidney to produce 1,25, here is 1 and here is 25 dihydroxycholecalciferol or calcitriol. Another form, which is 24,25 dihydroxycholecalciferol, would result, but it is less potent. What are the functions of activated vitamin D3? As we mentioned, that the active form of vitamin D3 or 1,25 dihydroxycholecalciferol is to maintain normal plasma calcium levels. This can be achieved by increasing uptake of calcium by the intestine, by increasing the senses of calbindin, and the calbindin will increase the absorption of calcium from the intestine as the active form of vitamin D3 acts as a steroid hormone, as we mentioned before. Again, activated vitamin D3 minimizes the loss of calcium by the kidney and stimulates resorption of bone when necessary. When necessary, we mean that when there is a decrease in the level of calcium and the plasma, activated vitamin D3 and the presence of parathyroid hormone will increase mobilization of calcium and phosphorus from bone. But under normal conditions, activated vitamin D3 stimulates osteoblasts, which secrete alkaline phosphatase. Alkaline phosphatase will increase the position of phosphate and subsequent bone mineralization. So under normal conditions, calcium deposited in bone, but under low calcium levels, vitamin D3, the activated vitamin D3 will stimulate bone resorption to remove calcium from bone to the blood. This figure illustrates the response to low plasma calcium. When the plasma calcium gets low, this will trigger or stimulate the parathyroid hormone secretion, and the parathyroid hormone secretion will activate the process of hydroxylation of vitamin D3 in the first position to produce 1,25-dihydroxycholecalciferol. Parathyroid hormone by itself, it will cause calcium mobilization from bone, but this with the help of the activated vitamin D3. Again, parathyroid hormone will increase renal absorption of calcium, again in the presence of activated vitamin D3. Parathyroid hormone will decrease renal excretion of calcium in the presence of activated vitamin D3. Activated vitamin D3 by itself will cause increased calcium absorption from the intestine as it stimulates the synthesis of calbindin, and the calbindin binds with intestinal calcium and increases its transport to the plasma. As a result, there will be increase in the plasma calcium. What is deficiency of vitamin D? Vitamin D deficiency may result from improper exposure to sunshine, or it may be due to decreased absorption, as in case of obstructive jaundice. Again, vitamin D deficiency would result when there is decreased activation, as in case of liver and kidney diseases. A rare condition of vitamin D deficiency may result from failure of binding between activated vitamin D3 and its receptor. What are the manifestations of vitamin D3? In adults, the deficiency of vitamin D3, the deficiency of activated vitamin D3 would result in osteomalacia. Osteomalacia is characterized by bone softening due to defective mineralization, and it is more common in females with multiple pregnancies and bad eating habits. Osteomalacia will be manifested or is manifested by bone deformities, bone pain and aches, and easily fractured bones with delayed healing. In young growing children, activated vitamin D3 deficiency will result in rickets. Rickets is characterized by softening and deformities of bones, delayed teething, standing and walking, bow legs, passing of frontal bones, pigeon chest, and recti rosari due to enlargement of the costochondral junction. What is vitamin D resistant rickets? Patients with kidney disease will suffer from vitamin D resistant rickets. They cannot activate available vitamin D. They are treated by administration of activated vitamin D3 or by injection of calcitriol. What are the biochemical changes in vitamin D deficiency? Number one, there is decreased serum 25 hydroxycholecalciferol and phosphate levels. Mild decrease in serum calcium levels only in severe cases. There is increased level of serum alkaline phosphatase, bone isoenzyme, with increased levels of parathyroid hormone. There is toxicity of vitamin D when taken in large doses. Yes, vitamin D is the most toxic of all vitamins. Why? Because large amounts of vitamin D will cause hypercalcemia. Calcium, when gets high, will be deposited in bones and soft tissues, causing metastatic calcification. In young children, the hypercalcemia will cause premature closure of sutures and fontanelles, and that will lead to microcephaly. Again, calcification of soft tissues, for example of the kidneys, will lead to renal failure and nephrocalcinosis. Thank you.